Thank you, Chad. Thank you so much. Thank you, everybody, for being here. My name is Nate Sikander. I am the CEO and co-founder of Kinesio. Our goal at Kinesio was to leverage hardware that we could buy off the shelves, essentially, and use our amazing patent-pending software to bring a digital and technological revolution to healthcare. And physical therapy was the first area we looked at. So you guys are all familiar with the Wii. Everyone knows what the Wii is. It was a really cool gaming mechanic that was brought sensor technology to the gaming industry, and it was used by senior citizens everywhere. Introducing the Kinect 3 years later, it brought a level of accuracy in motion tracking and gesture tracking that had never been seen before. The new Kinect, which comes out, I believe, on Tuesday, to the public anyways, brought a level of precision coupled with accuracy that is the pivotal part of any scientific data collection, and it gives us the opportunity to create that life impact that we're looking for. Physical therapy, many of you have done it, and every one of you has hated it. And there's several reasons why. It's boring, monotonous, and it's stuck in the 17th century. They're still using goniometers, which is basically a ruler and a protractor to get your range of motion. If they're even doing that, they might just be looking at it with your eye. So I would like to introduce the audience in physical therapy to the ADEPT system, our advanced digitally enhanced physical therapy. So the first step to anything that you do is the first step. So right here we have a range of motion assessment, and this is the baseline establishment for everything that happens throughout your entire physical therapy procedures. We take this information and we tailor your physical therapy to your ranges that you're able to do, and it gives us a baseline to measure improvement. The next step is to actually do a clinical analysis and have a physical therapist prescribe you exercises to do. Our software will monitor to make sure you're doing the exercises correctly. It'll give you real-time feedback. It gives you counters, and since you're using the Kinect, it's a very intuitive interface for you to just, raise your hand to pause your exercises or things like that. What we're doing is we're creating a continuum of care, and we're closing the gap on physical therapy adherence and bringing in your caregivers, bringing in your insurance providers to let them know that, hey, this guy's doing the exercises, this girl's doing her exercises, and they're doing them properly. And the really cool thing behind this is that we're creating a revolutionary way to collect data and evaluate data. Our goal is to determine what type of exercises the 37-year-old male that just had rotator cuff surgery should be doing to stay healthier longer and get healthier quicker. Like I said, simple hardware. We use the Kinect 1 sensor and the Surface tablet. The real secret sauce lies in our advanced patent-pending software. The software is really robust and allows us to go into other markets very quickly and very easily. Consumer fitness, another extension of quantified self. Professional sports, there's a whole slew of data that can be used to analyze athletes' performances and how they'll stay healthier longer. And then remote patient monitoring, bringing digital nurses to people that don't have access to it. So we do have some competition in the space, but most importantly, our value differentiator is that we close the loop on the care to your provider. Everyone that is involved in your care knows what's going on with your exercise regimen, your physical therapy, and can see your improvement. And then the predictive outcomes. That's where we really see the value in what we're doing, 2-3 years from now when we've collected just tons of data going forward. So our model for business, how do we make money? We're a SaaS company. Software as a service that is the only way to go, really, for what we're trying to do. Low cost of entry, and then that monthly recurring revenue that keeps the business going. So our team is a phenomenal team. We've been working with the Kinect for over 3 years. We actually, we didn't hack into your bank accounts or anything, but we did hack the Kinect to actually use it to create software before we were actually able to. Microsoft finally let us about 10 months after it came out, but this time they've given us access before it's even came out, so they've learned a little bit there. Awesome team of advisors. You just met Chad. David Espinlab and Azam is awesome FDA regulatory. He's had many devices go through that pathway, and that's something that we're going to have to deal with and are currently dealing with. So we have some partnerships with some clients, working with some MLS teams to create the professional sports data analytics packages, American Specialty Health, and we're proud partners with the California Chiropractic Association. So our timeline here, we've launched our beta. So to date, we've already captured over 10,000 ranges of motion. And we're planning to go live on January 9th when we unveil our product at Parker Chiropractic's annual show in Las Vegas. We'll also be releasing our remote patient monitoring there as well. Early Q3 is when we anticipate the FDA approval to be finished and get ready to bring physical therapy to the market. So we're all here for a reason. We're asking for money, and we're looking for $750,000. And what that will do, it will help us develop our analytics engine. It'll provide EMR and practice management integration to give more value to our clients. And most importantly, if you have an awesome product like Kinesio, you need people out there marketing and selling it. So we are Kinesio. I thank you for your time, and I ask for you guys to help us measure, monitor, and make a difference. Thank you so much.